Dr. Greenblatt, thank you so much for joining us today.
Very glad to be with you. Appreciate the opportunity to share some thoughts.
Yeah, I'd love to know more about your background story and how you got into integrative and functional psychiatry. So many of the psychiatrists that I've talked to historically have been more traditional minded, but what takes a psychiatrist, what kind of journey takes you down the path of nutrition and functional medicine?
Well, I actually went into medical school many years ago thinking I was going to cure the world, with brown rice and kale, and was vegetarian at the time. And I came out, 9 years later as a psychopharmacologist treating kids with medications. And so it didn't take long to get out in private practice to realize the limitations of medicine. And then from the 1990s, I've been exploring and researching and kind of trying to communicate the literature to clinicians about what a profound influence diet has on mental health. Thank God the research community has caught up, and most of the things we've been saying for 30 years has been shown to be evidence-based.
Did you have any great um, mentors or influencers on your career path? Like I mean, names like Abraham Hoffer to me come to mind in that realm, but I don't know who you've read or kind of if there were any that really got you thinking differently.
Yeah, no, Abraham Hoffer is the guy. I did a paper on his work in college before I even had any thought of going into psychiatry, and I've been part of the Orthomolecular Society and got to meet Dr. Hoffer a number of times. So absolutely his kind of wisdom and his ability to think beyond a medication was an inspiration for me even before I got to medical school. So Abraham Hoffer, Linus Pauling, and Roger Williams, an old name, who just made things very simple about helping people appreciate how different we all are biochemically.
Yeah, yeah, same here. I read biochemical individuality in grad school, and it changed my trajectory as well. Let's talk about anxiety. I know right now, especially, COVID, post-COVID, the younger world has really been racked. I mean, statistically, we've seen that skyrocketing. Can you talk a little bit about that?
Sure. I mean, at this point, it's anxiety is the number one mental health challenge around the globe. And what has been particularly frightening is our kids and adolescents often paralyzed by anxiety. And we can think of all the external, you know, things in our environment, from social media to watching TV about fighting and bombs and wars, which maybe we didn't have, 50 years ago. But I also think it's also clear that then the research is supporting it that our diets, the diets we're feeding our children, ultra processed foods, lack of key minerals, have played a role. And that's most of what my work has been, is helping parents understand some of these nutritional deficiencies affecting the course of anxiety in kids.
So just educating parents about better diet practices and policies at home, is that a big core of your platform then?
Well, I mean, I think there are enough people saying eat well and exercise, and I think as a functional psychiatrist in my world, I'm doing a lot of objective testing. I'm saying I don't know what's going on, but I'm going to do these 5 or 6 tests to look at levels of magnesium and copper and zinc and amino acids and fatty acids and food allergies or reactions to gluten. And I'm going to determine if there's something biochemically contributing to the anxiety.
Okay.
And, 8 out of 10 times, we're going to find a number of problems that can just really support recovery. I mean, medicines work better if you have to use medicines. Therapy works better if you're using psychotherapy. And some of our lifestyle mindfulness approaches all work better when we can kind of fill in these nutritional deficiencies.
So testing to get an objective biochemical basis for making your recommendations is something you're doing very frequently then.
Yeah, it's really the key. It's the key of all the teaching I've been doing. And again, as a psychiatrist, myself and my colleagues, we're seeing patients that have failed, medication, have failed psychotherapy and really struggling. And I don't want to be part of that, just making another guess. I want to be objective and have a lot of data in front of me and say, listen, Peter, you're deficient in magnesium and you have a genetic vulnerability to need a little more vitamin D. And then it's much easier to make a difference and to pretty much eliminate the symptoms.
Do you use a lot of nutritional therapy or in dosing, or do you more rely heavily on food, or is it just kind of a combination of the two?
I think my practice is heavily on finding nutritional deficiencies or metabolic abnormalities. And so nutritional supplements are probably 70% of it. Um, and medications when needed, but always work better after the nutritional repletion. And then oftentimes, in the mental health world, there's still a role for psychotherapy.
Yeah. What has been your experience? I found one of your articles a month or two ago on gluten and psychiatric dysfunction or disorders. Can you talk a little bit about your experience with the gluten-free diet as a tool to help people feel better?
Yeah, I mean, there's so many paths towards, gluten and mental illness. Um, and the research is actually quite extensive. And that's what's so frustrating that none of my colleagues address it or bring it up. I came about the relationship between gluten sensitivity and mental health challenges probably 25 years ago when I started working with patients with anorexia nervosa. So eating disorder patients, malnourished, and if we dug deeper, we found that they had, antibodies to gluten and biopsy, they had celiac disease. So there was tremendous relationship between eating disorders and celiac disease, going both ways. Higher incidence of anorexics developing celiac, and celiac patients have a higher incidence of anorexia. And then, over the course of doing all this testing that I described to you, every patient that walks in the office, we're looking at iron and B12 and D. And I was getting deficiencies in healthy young adults who were eating meat and vegetables and a healthy diet. And the only path to these nutritional deficiencies were often celiac. And so one of the things I stress in my teaching is you don't always have to have GI symptoms of celiac disease. Oftentimes we have patients presenting to a psychiatrist's office, their only symptom is anxiety or depression. And if you don't look for celiac disease, you might be missing the cause of that anxiety and depression.
Yeah, that kind of reminds me of some of the work that Marios Hadjivassiliou at Oxford is doing on gluten as a nerve toxin, and they're looking at things like cerebellar ataxia and neuropathy independent of GI symptoms. So they've actually redefined in a way gluten sensitivity as a neurological disease. Do you do antibody testing like for neural antibodies to determine whether or not gluten could be contributing to neural inflammation, or is it more along the lines of kind of classic anti-gliadin, anti-tissue transglutaminase, anti-indemycyl antibodies?
Yeah, routinely it's been just the anti-gliadin antibodies. I think that, and there's another world of schizophrenia and gluten, which is just fascinating. And I wrote a chapter for Dr. Hoffer's new book, a new edition of his old works. They asked me to put a chapter on gluten and schizophrenia. And the research is extensive. Some of it is just celiac disease undiagnosed, but then there are other mechanisms of gluten sensitivity and immunological responses unrelated to celiac that contributes to psychosis and schizophrenia. So, as a child psychiatrist, I try not to make too many rules about diet until I do the testing. But for anyone with psychosis and schizophrenia, I would strongly recommend, and hundreds of patients have done well, a gluten-free diet, regardless of any testing.
Just because you've seen that well of a response and there's enough literature to back the diet change. Is that
Yeah, hundreds of articles. Again, high relations of undiagnosed celiac, and then there's some other unique mechanisms that they found, immunological mechanisms, but it's not always the answer, but almost everyone gets better, and then we can start digging deeper and looking at some of these other root causes.